Hi, this is Dr. Neil Schwartz. Today I'd like to talk about the concepts of relapse, remission, chronic inflammatory ailments, and the goals of treatment with all chronic conditions. I get many emails per week asking this question. Quote, Dr. Neil, once I get complete control of my acne in your program, will my acne come back and will I have to use your products for a lifetime? My response is typically this. If you've had acne for many years or for a long time with many failures, expect to be using some sort of acne preparation or topical product for the next 10 years, whether it be from this practice or from anywhere. Expect that you'll be treating this condition in some way, regardless of whether you balance your diet perfectly and keep your stress to a minimum. Expect that you'll also have to maintain your skin in some way in this lifetime. The reality is this. Many people who get totally inactivated here will have to use minimal to none of the products to maintain that inactivation. Some people will have to use some of the products occasionally or maybe one step here or there, and other people will have to use a full multi-step system to maintain the results that they have just achieved. It depends on how prone your skin is to acne. It may also depend on how much stress is in your life, but expect the long term to be different for everyone depending on your proneness to acne. Fortunately, the refills in this practice are reasonably priced at $15 to $25 per product as needed every 6 to 8 weeks, and you do not need to reorder or repurchase new starter kits once you have become a member here. Now, let's talk about chronic inflammatory conditions of the human body in general. Rather than looking for magical solutions or magical products, here are your goals for treating chronic inflammatory ailments. Goal number 1, achieve complete inactivation. In acne, this means no bumps, no oil, no discomfort, and all with skin that is comfortable and smooth. That is your first goal and your only goal when you have an active acne situation. Once inactivated, goal number 2 is to emotionally heal from the ordeal. Whether you've had acne for 3 months or 10 years, once you get inactivated, there's going to now be an emotional component that needs to heal, because having acne or any other chronic inflammatory ailment is traumatizing to someone, and this trauma needs to heal as well. That's goal number 2, emotionally heal from the ordeal, regardless of how long it's been going on. Goal number 3 with chronic inflammatory ailments is to maintain the balance in an efficient manner so that you can live your life without worry or fear of relapse and still maintain this symptom-free lifestyle. So in acne, that means you may have to continue using products at a certain degree to maintain this balance, and if it's another part of your body, you may have to have a certain lifestyle tip or a certain lifestyle remedy to keep yourself balanced in your joints and your muscles and your GI tract. All of them need maintenance of some sort, and you make it part of your day. The key of goal number 3 is to make this maintenance as efficient as possible so it doesn't distract you from the other goals and missions in your life. What I've noticed, and what you'll notice if you pay close attention to yourself and others who are suffering, is that with each relapse comes an amplified emotional response. It's what some would call a stack attack, or a stacking emotional response to the symptoms of today on top of symptoms and breakouts from the past. And so historically, the past ailments plus today's ailments will stack and create almost like an explosive emotional reaction. It's something to take note of because it's this stacking emotional response that will generate hopelessness even after you've had success in the past. For example, someone in acne boot camp may get completely inactivated for the first time in 10 years. Then, 4 months later, they may lose the handle or lose the balance and need my assistance again. Now, what they were supposed to do is as soon as that symptom started to relapse or show itself, they were supposed to immediately get into communication with me and find out what they needed to adjust so that they quickly put out the fire. Instead, here's what sometimes happens. someone has 10 years of acne, gets completely inactivated, and then 4 months later has a relapse, and then goes immediately to hopelessness and assumes that nothing can help them. So what's important to note is that this stacking emotional response can generate hopelessness in a flash. If you're having relapses of acne after having some success, know that you're at high risk for generating a hopeless conclusion that your acne is not treatable at all. And it's in this hopelessness that the real disease lies. This program, from the onset, has been set up to address this hopelessness. The way we address it is with daily participation and daily communication to reveal all the details that are needed to adjust someone's program and give them exactly what they need at that time. It does require communication with the stubborn cases. A quick recap. Expect your acne to try to relapse, but make sure you ask for assistance if it does so that you can quickly get back on track. Number 2, your goal is to inactivate, emotionally heal from the ordeal, and then maintain in the most efficient way possible. And number 3, know and observe that relapse causes a stacking emotional response that can generate hopelessness in a flash. And as a last point, it's this hopelessness that is actually the real disease. Once someone finds this hopelessness, they have sealed their fate, as they are no longer seeking solutions and no longer asking for assistance, and thus they will suffer from conditions that are known and proven to be treatable in all cases without exception. Acne is a treatable condition, as proven by the high-definition video gallery. If there's ever any question on whether your specific case of acne is treatable, I recommend watching all 140 videos on the highest resolution screen you have, critically and scientifically, so that you can make the same conclusions that I have made. I'll be here if you need. Take care.